Hello class, my name is Tanisha Patton and today I'll be discussing with you breast cancer among African American women. First, let's start by stating what is breast cancer. Defined by American Cancer Society, breast cancer is a malignant tumor that starts in the cell of the breast. A malignant tumor is a group of cancer cells that grow and invade other parts of the body. While breast cancer is most common in women, men are able to get the disease as well. Some of the symptoms of breast cancer include swelling of the breast, lumps, tenderness, discharge of the nipple, redness of the skin, breast shape change, and or pulled nipples. All are depicted in the image. These are symptoms that simply meet the eye. Breast cancer can be diagnosed in many of the following ways. Your physician can perform a breast cancer screening, which is a physical exam, biopsy, using family health background. Any of these tests can result in a benign or malignant tumor. Women make up 14% of all new cancer cases that are going to be diagnosed in 2015. 231,840 of those were breast cancer. Overall, 61% cancer stays localized to that initial site without spreading. Breast cancer is the most common cancer amongst women, and 1 in 8 will face invasive breast cancer in their lifetime. There is a 1 in 36 chance, which is about 3%, that a woman will die from breast cancer. There are currently 2.8 million survivors living within the United States. We show here that while white women are 6% more likely to get breast cancer, African American women are 16% more likely to die from the disease. This is per 100,000 that in the year 2013, while 123.3 white women were diagnosed to the 118 African American in the same year, 31.6 African Americans to the 22.4 white women faced death. This article on prevalence showed that African American women are less likely to be diagnosed when the cancer is only in the localized stage. This article explored how the delay of treatment leads to an increased mortality rate amongst African American women. Researchers explored how delays in treatment affected each race and what barriers were causing the delays. Delays were caused by detection, time frame of detection, and clients having inadequate insurance. Out of 634 white and African American participants, both faced surgical delays. However, the differences were noticeable. When a white woman had a surgical delay, it typically was a personal matter of tumor size and type of surgery to have for her. While for African Americans, it was what surgery could the client have that was covered by insurance, and also the tumor size. The researchers concluded that there is a great need to educate the African American population of women in urban and rural areas, show them the importance of getting a breast exam. This next article focused on socioeconomic disparities by starting a study in California of 6,262 women of all races. They categorized by race and subtype of breast cancer, identifying that inadequate follow-up treatment due to lack of resources is a leading factor in survival rates. African American women of low socioeconomic status had highest mortality rate. Not far behind was that of the Hispanic women of the same economic status. Regardless if a woman is of low or high socioeconomic status, she was most likely diagnosed with triple-negative breast cancer. That is the most common subtype of breast cancer amongst the African American population with the disease. The researchers concluded that there should be further research done to see how these disparities will persist had the patient or survivor received longer follow-up care. This article highlights how doctors approach treatment for African American women differently. They have preconceived notions of the person based on race stereotypes and assumptions. Researchers interviewed a multitude of doctors, and all but 2 yielded the same results. They would dumb down their information on patient cancer status. Instead of providing information comprehensively, they were not as forthcoming with information, assuming the client did not understand due to a lack of education. Researchers concluded that doctors should gauge how to communicate effectively with patients of all races and become familiar with the specific health beliefs of the patient. Meet the patient where they are in terms of their concerns. By doing so, could impact the population greater. This article highlights the CDC campaign to bring awareness to the community about breast cancer and early detection. It used a mass media approach to reach the target population of African American women. By using TV, radio, print publication, and having a hotline to take calls, they were able to reach a multitude of women in all races. They realized black radio was a great source for reaching out to African American women, and the campaign helped educate and caused many women to get a screening or reach out to a physician. This next article, researchers focused on the survival of African American women who were diagnosed with breast cancer and also are obese, overweight, or morbidly obese. These are all considered comorbidities. It highlights how obesity and lack of nutrient-enriched foods can lead to African Americans getting diseases. The article showed how many African American communities are accepting of the full-figured woman and sees nothing wrong and ignores possible health concerns of the individual. It also explores the woman's attitude toward obesity and body image. This web of causation shows how age at diagnosis, socioeconomic status, nutritional factors, culture, lack of access to adequate health care, family history, all are contributing factors to breast cancer among the African American population. Each one are related, and the previous articles help explain how some or all lead to disparities amongst the population. As a future social worker, it is always best to explore interventions to help the population and decrease the statistics we're faced with here. In this social work perspective article, researchers used an aerobic strength-based home intervention method to help increase the rate of survival timeframes in the African American community. In the African American community, survival is less than 5 years, and this is partially due to poor exercise post-surgery, which is a very important thing to help the blood flow within your body and to get everything back to how it should be functioning properly. Exercise intervention helped reduce mortality rates amongst the participants in this study for the African American community. The program itself rated very top scores from its participants, saying that overall they felt that it helped them and keep them active during this time where it was very important to be so. It is very important that those facing these challenges get help and reach out. So locally we have Family Health Enterprise. They have something called Cancer Matters, which is provided by a grant from Susan G. Komen for the Cure of Greater Atlanta. They provide free or reduced cost mammograms for women over 40 and those younger with breast concerns. Finally, we have gathered that breast cancer is a malignant tumor that starts in the cell of the breast. There are many symptoms that can be diagnosed in a multitude of ways. A health screening is always a great first step. While breast cancer is more prevalent in white women due to inadequate health care, socioeconomic status, family history, among many other factors, African American women are 16% more likely to face mortality. Around the world, there are many efforts being made to bridge the gap for African American women. Locally, we have the CDC and great resources such as Cancer Matters. I chose this topic due to the fact that my own mother was diagnosed with triple negative breast cancer. Although she is not of low socioeconomic status, she was diagnosed at stage 4. She was diagnosed in 2013. After her first surgery, which was a mastectomy, she moved to stage 2 and then it came back, and now she is at stage 4 again because it has spread throughout her body. It is currently in her lungs and she goes through chemo every day for the last year. So by continuing to stay aware and educated, we can help not only ourselves but others to see the benefits, because chances are you or someone you know is affected by the disease.